Okay, you're basically asking, was the population have to deal with how the price of the plans? And really, it's not so much the population as it is which region they live in of Tennessee. This was actually broken up by the federal government. It was actually separated in Tennessee into those 8 different regions. It's going to have, again, those 3 bases, how those 3 bases factor in across that particular region. So with the age, the smoking usage, and also, again, within that region, how that's broken up into is going to play a factor into what those rates are going to be for those people in that area.
Governor 741-2001, just happen to know that, is important. Talking to your legislators, you know, the legislature just passed a bill that said there can be no acceptance of federal funds to do either the Tennessee plan or the Medicaid expansion. So that means that in order for it to happen, there has to be a majority of legislators who, on the floor of the legislature passes it. So before, the governor could have just put it in his budget, it would have passed. They would have had to pass the budget. Now there has to be a vote. So it's important to both reach out to your legislator and also and to the governor. I can send out a link, but there's a website that has up-to-date information. There's videos. Follow the Tennessee Justice Center on Facebook and Twitter, because we have regular weekly meetings if people want to attend. You know, the difficulty is when you have every chamber of commerce in the state, every healthcare provider, every health insurer, most every church group in the state for something, and the governor says no, it's hard to really figure out how you get a handle on passing something like that. But I think continuing to educate, there's over 60% of Tennesseans who are for it. The other 40% would be for it if they understood what it's going to do to our healthcare infrastructure. Over 20 hospitals are likely to close in very short order without this. So I think a key thing during this, when the legislators go home and we are moving towards election season, is just educating the public about what this means for you. Even if you don't know anybody who is, and there's 330,000 people who would be covered by this. But even if you don't know any of those, you don't care about that, it's going to affect your hospital, who's a large employer in your rural community. It's going to impact your ability to access hospital care when you go to get it. So, so I can send out a link with the regular meeting times, and I can send you a link with our video. But follow the Tennessee Justice Center on Facebook and Twitter.
Linda, real quickly, Connor works for Roy.
And actually, an increase in hospital revenue if we expand Medicaid will be $1.7 billion just for the hospitals, because the people with insurance, they'll go and they'll pay for the surgeries that they're having to have. Also, 30 counties will have all the hospitals in their counties will shut down, and so 1,115,000 people will live in a county that doesn't have a hospital. So that's just something to take into account when you're putting pressure on the legislatures to actually, think about the people that they will be affecting when they don't approve of this Medicaid expansion.
Say that again, the numbers. Say those numbers.
30 counties will have hospitals closed in them so that they don't have any hospitals in those counties. And then I did the math myself with the populations of those counties. That will be a little over 1,115,000 people will live in a county that does not have a hospital.
On your seats that is from the Kaiser Family Foundation, and they are well respected by really everybody in terms of the information that they provide, and it is specifically about Tennessee and what will happen to uninsured people under the Affordable Care Act. So just it's a lot of good information.